I'm going to talk about something that has been around for several months now, 8 or 9 months now, but I'm continually surprised at how few people know about it. And that is called monoclonal antibody. Now, that is a big mouthful, but it is essentially where in a pharmaceutical laboratory, you can manufacture antibodies that will fight COVID infection just like your own body would. So your natural immune system is going to start fighting it off. But for a lot of people, particularly those in high risk categories, they could use a little help. And so this is a medication, some people call it a therapeutic, that you can take to prevent the progression of your disease. It's essentially boosting your own antibodies and your immune system. It's been around since November of 2020, so we've had it for about 9 months, and there are actually multiple different products and manufacturers of that. The best news is that it is in full supply. We have no shortage. We have it available all over the state. Primarily, it is given in an IV infusion. It takes about an hour, and then they watch you for an hour. I promise you, if you are high risk and you get infected, there is no better 2 hours than you can spend of getting that infusion because it is so highly effective of keeping you from progressing to the need of hospitalization or even more severe disease. But there are some people who it is more geared towards. So I told you it can be an IV infusion. Now, in some instances, they can also give it to you subcutaneously, which is basically a shot, but the best way is still in an IV infusion. So if you get a positive COVID test and you have had symptoms for less than 10 days and you are at risk for progressing to severe disease, that means you have underlying medical conditions or you are of advanced age. And I'm not talking about really serious medical conditions, even common medical conditions like hypertension, high blood pressure, and obesity. Those are risk factors, diabetes, those are risk factors for progression to severe disease. So if you are a high risk individual, either by your age or your medical condition, after you get that positive COVID test, your very first call should be to your doctor or to a facility that has monoclonal antibodies in order to go ahead and get on this schedule and get that infused.